Today we're talking about RESPECT, or maybe I should say RESPECT.
Oh my God, I love it.
I'm Dr. Arnell Wright.
You are the star, Arnell, right? And I'm I'm the humble Dr. Effie Ioannidou.
No.
We are talking about how to create a positive work atmosphere and confidently cultivate the respect we deserve in interactions with our peers and patients. And I think this is so useful in every work environment, especially in academics.
From the American Dental Association, this is Dental Soundbites, created for dentists by dentists. Ready? Let's dive right into real talk on dentistry's daily wins and sticky situations.
Hi, friends. Welcome back to another episode of Dental Soundbites. Please help us by rating the podcast on Apple Podcasts, Spotify, or wherever you are listening.
And don't forget to write a review. That will help us continue to support other dentists and our great profession.
Yes. This episode is always one of our listeners' favorites. Today, we're going to hear from real dentists in real sticky situations. And this time, we're dealing with disrespect in the dental office.
You know, I am not surprised at all. It seems like the ADA Wellbeing Survey found that younger dentists feel less respected by their patients than older dentists. So we wanted to hear your stories and offer ways to maintain professionalism as well as to ensure a very respectful work environment.
The real star today is our guest. And as you guys can tell, I'm very excited. I'm geeks. I've been waiting for this episode and for this guest to come on our show. So we have Dr. Zerita Buchanan. Hi, Dr. Buchanan. Can you tell everybody about yourself and a little bit more about your work?
Hi, thank you for having me today. I am also a huge fan, Dr. Wright, so it is great to be on a podcast with you and great to meet you, Dr. Effie. Thank you for having me today.
Of course.
My name is Dr. Zerita Buchanan. I am a general dentist. I've been practicing for the past 10 years. I actually celebrated 10-year anniversary this year from dental school. I practice in Lithonia, Georgia, which is about 30 minutes outside of Atlanta. This is where I'm from. I am a proud graduate of Spelman College, which is an HBCU here in Atlanta. And I went on to get my degree from UNC Chapel Hill School of Dentistry. And I am happy to be with you all to talk about sticky situations because I think I've seen them all in private practice.
Oh, I bet you did. So let's get things started. So can I call you Zerita?
Please.
Oh, I love it. So, Zerita, we hear that you have a story about issues of respect in the dental office, and I'm dying to learn and understand exactly what you guys go through in practice. Then later on, I can share my own experiences in academia. But tell us exactly what happened and how you responded. I think a lot of our listeners will be learning from your experience and sharing your reaction and how you dealt with it.
Yeah, so I actually have a pretty interesting dynamic at my practice. I practice with my dad. So when I joined the practice, he had been telling all of our patients, hey, my daughter's joining us. She's graduated from dental school soon. And they had all been with my dad like long-term patients, right? So they were really excited for me to come in. But the dynamic between father and daughter, I think, was picked up by some of my patients. And so my sticky situation has to do more so with money. And when patients start to question me on how much a procedure costs or why they're paying certain amounts. So one of the things that I noticed really early on, my dad was probably my best teacher when I started in private practice. He taught me kind of the ins and outs of having great bedside manner, how to really, interact with patients and make them feel comfortable. So when I would present a treatment plan to a patient, I would tell them, hey, you need a certain procedure. And I would, go over the fees. I like to tell my patients directly kind of what the fees are, and then I'll pass them over to my office manager to collect, and we can get started. One of the things that I noticed early in my career was the fact that some patients would question a fee based on the amount of time it took me to complete that procedure.
Oh, that's very
for
common.
example,
Yeah,
I was doing an extraction. It took me like 10, 15 minutes to get the tooth out. And I was like, okay, we're done. And the patient was like, well, why did it cost that much money if it only took you that amount of time? And I politely responded, you're not paying me for the amount of time it took. You're paying me for the amount of time it took me to be trained to do it for you in this short amount of time. And so that was my sticky situation. A lot of times I feel like patients believe the longer a procedure is, the more costly it should be. But that's not always true in the dental office. Our goal, is to provide care in a quick and easy fashion, while it's also, the best result for the patient, the best outcome. So that was my sticky situation. I learned a quick little response to kind of stand my ground, get compensated properly, and also explain to the patient, this is something I take very seriously. So I took a lot of time to be trained to do it for you.
Oh, that's a very smart, reaction to the kind of inappropriate comment of from the patient's perspective, right? But I wanted to ask, I'm curious to know if you have any sticky situation to share related to the fact that of the dynamic father-daughter. Do you think that at the beginning of your practice, people would question the fact that you're so much younger and maybe assume that you are so much more less experienced or more inexperienced? So did you experience situations like this?
I did. A lot of people would ask me, are you old enough to be a doctor? And I was flattered by that. Anytime somebody would question your age. But I didn't take it personally. I kind of anticipated that. Also, a lot of these patients I had grown up around, so they weren't used to me being in a different position where I was providing them care. They're used to seeing me, at my high school graduation or their family friends. So being in a position of authority was interesting for some of my patients, that dynamic. But my dad did a really good job of kind of introducing me to the practice before I even got there. But one of the funny, little things that has happened to us more than once, new patients sometimes ask us if we're married. And I'm like, no, that's my dad. Like, can't you see the age discrepancy here? I get that a lot.
Yeah.
Because we have the same last name. And so they're like, is that your husband that you practice with? And I'm like, no, that's my dad. But thank you for the compliment, I guess.
Aw, that's so good. You know what? You said something that made me strike a chord actually with me, or it resonated about discussing fees. So I have been practicing now for 7 years. This is my 7th year, right? And I always were afraid to practice to discuss fees. But now I feel like with more experience, I've become so much more comfortable with that. Mm-hmm. And I feel like there are some things that should come from the doctor. And I know that, our listeners, they may disagree or whatever, but I love the fact that you shared that tidbit, because I think that's going to help some of our doctors out there. The more you practice, there are some things that I do think that we should talk about and then do that handoff. Yeah, absolutely.
And I think, you're kind of taught not to talk about
Agreed.
it. I think that is the general understanding. But for me, I was like, this is my own lane. I am in a private practice. I felt very comfortable discussing money. And so the ins and outs of insurance, I leave that up to my staff, right? But I've noticed, and it's not fair, but I noticed that a lot of patients take information from me differently than they'll take it from my office manager. And, I don't like that. I have to be honest. I don't like that because I feel like it's a little bit of a respect issue. They feel like, oh, I'm the doctor, so they're going to treat me with a certain level of respect, but then they'll treat my staff differently. And so, anytime I hear anything inappropriate or if anyone's being rude, I definitely step in and I stick up for my staff members because we are a family, we're together all the time. But I do feel comfortable discussing money, especially when it's larger cases, because if you want a patient to buy in, you want them to know, hey, the ins and outs of this entire package that you're presenting to them. And I found that my case acceptance goes up when I do that, especially if they're uneasy about the fee. I can reinforce why it's so important for us to do these steps.
Yep. Ooh, I love it so much. Okay. So full disclosure, the ideas that were sparked in this episode, they do come from recent conversations that our producers had with a group of dentists. These dentists, they helped us pick some of the topics for this episode. And we heard Dr. Rachel Jahraus tell us something that we think would resonate with many. So we're going to take a quick moment and hear from Dr. Jahraus.
Hello, my name is Rachel Jahraus, and I'm a general dentist in Hilo, Hawaii. I did a 2-year AEGD residency after I graduated in 2020, and I've been an associate in a private practice for about 2 years now. So the sticky situation that I wanted to share is just trying to be perceived as a leader and to gain both the respect of my patients and my staff. I certainly try, to not wear pink or pattern scrub, nothing too cutesy. I always introduce myself as Dr. Jahraus. And then with the staff, I've been very fortunate that a lot of the time I've had staff who are my age or older, so they've got some experience, which is great. But at the same time, when you're trying to and needing to give clinical direction as a resident or as an associate, you may get more pushback because that's not how their previous dentist did things. So that's been an interesting challenge to try to address. And I know I had one of my co-residents when I was in residency had a very apt remark. She was like, as a resident, and I feel like as well as an associate, it's not a question of being like the high or the low person on the totem pole within the organization. You're kind of like the weird arm sticking off to the side since you don't have that hiring and firing power and you're not quite as integrated within the organizational structure. So there's a few different things that I've tried to kind of address these challenges. One, when dealing with the staff, I realized that as an introvert, my personality might mesh well with the introverts on the team, but possibly not so much the extroverts. So I've been doing a lot of reading on personality traits, personality types to try to better understand and relate to those more extroverted members of the team. And then for the patients, I've come to realize that I'm not going to be able to single-handedly change some people's perception of what a dentist should be like. I also have to be true to myself, my personality, my practice philosophy, and that is going to resonate with a lot of people and maybe some people not so much, and that's okay. But I have been trying to certainly find mentors, particularly female mentors who have gone through some of these same issues before to kind of give me their life experience, help me learn from their mistakes, hopefully. I will say that that's a little bit harder to do in my small community just because, looking at the generation above mine, there were not as many female dentists. And I've joined study clubs and other organizations to try to find those relationships, those potential mentors. But like a study club meeting I was at yesterday, there were 26 or 27 people there, and I would say 6 of them were women, and 2 of us were, about the same age, younger dentists, not a lot of experience. So there's just sometimes not that pool of potential mentors to choose from. But anyway, that's my sticky situation.
Okay. What was the first thing for you guys?
The pink stuck out to me as I have pink on, and my heart kind of broke for her a little bit because I want us to be able to show up authentically wherever we show up and not worry about how people judge us based on how we dress. And the color of scrub should never be an indication of someone's ability to be a great clinician.
Yeah.
I have so many thoughts in my mind. You are absolutely right. Zerita, you're absolutely right. But also it makes me think and go back. As she was talking, I was trying to go back to kind of replay the story of my life. I remember the time that back in the 90s where scrubs were coming in one size.
Wow.
All scrubs were cut on male body, right? So I remember I was wearing those light green
The medical,
hospital scrubs that were the pants were so loose on me, and there was this huge string that you had to pull to tie it around your waist, and the top was like loose. And thank God now we have all these options for scrubs and the colors that you want to show your preference in pink. Good for you. You can call it Barbie, you can call it whatever you want, but it's what you choose, and we have to celebrate your choice, right? You have now Arnell on next on the screen. She wears the nice aqua Like, I mean, I'm not working for the fashion industry for sure, no, but I want to show that we have so many options to express our taste and our femininity and our choices in how we present ourselves, and we should be free to do this. This judgment is, I mean, to the patients, to put you in this position to defend your style is not very nice.
You know what I think about too? It's like our career and the profession of dentistry is difficult enough. So performing procedures, we go through so many barriers. And I think about this all the time in my day to day, that if I had to think about my scrubs, man, I'm always wanting to wear pink. I'm like the total opposite. So like every Friday for me is a pink day. You know what I mean? But it's definitely one of my favorite colors. So I'm just like, my heart also kind of sank a little bit too. I was like, oh man, I don't want us to go through that. You know what I mean? But I'm glad that we were definitely able to hear that story, you know, and I'm interested and curious about what our listeners, comments that they're going to leave, or maybe even discussions that may bud from hearing that scenario.
But can I ask a question to Zerita? What do you feel about, as we hear her perception about the workforce in Hawaii, in her small community, in the study club? What's your, reaction to this, and how do you feel in your community as a woman dentist?
Yeah, I'm honestly surrounded by a tribe of female dentists. I have some really close friends, even from undergrad, that went into dentistry. And so to me, I think I have a great perspective on the future of dentistry and how it's changing. Because if we look at the data now, dental school classes are predominantly female. And I think, that says something about how the profession is growing and changing. We still have a lot of work to do when it comes to diversifying the workforce. But as a woman, I feel very confident in my role as a dentist. I feel like I provide great care. I feel like my bedside manner is enhanced because I am a woman. I feel like I have a lot of compassion for my patients. There was one thing, though, that I wanted to touch on after hearing the previous clip. What you wear is something that does come to mind, right? When you go into the office, you want people to take you seriously. But another thing that I think sometimes certain practitioners have to think about is how their hair is presented. I think about it all the time. Will my patients take me less seriously, say if I have braids in my hair, or say if my hair is in a bun? Will my patients think I'm less professional? And that's something I had to grow out of, because I recognized your skill is never determined by how you show up appearance-wise. Your skill is your skill, and you can enhance your skill every day. But if you let the world tell you this is the mold of what a dentist looks like, a dentist has to be a male who wears black scrubs, who, shows up every day, with their hair neatly trimmed, then you're going to confine yourselves to these unrealistic expectations. And like you said, Dr. Wright, dentistry is challenging, it's stressful. And if you have the weight of the world on your back about appearance, it can cause you to, become unsettled and resent the profession as a whole. So I encourage all of our listeners to show up as you are, show up authentically, because if you are in the best headspace mentally, you're going to do your best work in the office.
I love that.
It's true. That's a very good point. Authenticity is really important. And I think at the end, as you said, patients receive this and understand it and appreciate it. And this is what helps you develop this honest relationships. So I think it's a great suggestion.
Mm-hmm. I agree.
So I keep referring to the academic life, and there are so many stories, and Arnel has heard me saying so many things about weird situations in academia, especially when you enter as very junior. And I have shared a situation where I was asked in my junior years to keep the minutes, assuming that if I'm the only woman in the conference, I should naturally be the one that keeps the minutes, because that's the woman's job, right? To have the secretarial job. But I never had any bad experiences with patients, really. Like the lack of civility and the lack of polite and professional behavior would come mainly from colleagues, and mainly from male colleagues. So these are the memories that I have. In my professional life. I remember as a junior faculty once in a thesis defense. I was asked by, as the resident was presenting their data, whatever, I was asked by a female senior faculty at the time if I can follow up and if I can follow through this presentation, and if I do have the knowledge to, do I know these things?
What?
And this was asked in front of the students.
Oh.
Shocking stuff. Now I think things have improved a lot because people are more aware and people react as you do and you defend yourself. But the weird situations, very weird, very sticky.
Yeah.
That is sticky. Last year, I moved to Boston to do a fellowship at Harvard T.H. Chan School of Public Health. And my fellowship director, Dr. Joan Reed, is phenomenal. She's like my super mentor. And she said, when people ask you questions that are off-putting or make you feel uncomfortable, a simple response usually will have them correct their course. And she said, just ask them, can you repeat the question? Or I beg your pardon? Say that again for me. And when they have to repeat that ludicrous statement out loud to the world or whoever's in the room, they will, take a moment to see how silly they sound. And, you don't have to go toe to toe with people who disrespect you publicly, but you can just simply ask them, I beg your pardon, can you repeat that for me? And it'll usually make them aware that what they said was insulting and maybe they shouldn't repeat it.
Very true.
Yeah. That's a very, very good point.
Very true. And you know what? We talked about age because, patients, they ask us our age sometimes, well, more often than not, actually. And I used to be like, oh, how old do you think I am? You know what I mean? I would say things like that. But now I kind of move past it. I want to get you guys' reaction on this, actually, because I move past it and I'm just like, oh, thank you. And I just keep on moving. I'm like, okay, so-and-so tells me that you're here for this. So is that like just skipping past it, or is that a good approach? What do y'all think?
I usually tell them my age. I'm not ashamed of my age.
Really?
I will always tell them my age and then wait and let them respond. I graduated dental school when I was 26 and I'm 36 now. So that, ask and I'll tell. I don't care. Yeah.
Ask away.
You graduated pretty young.
I went straight through. Yes.
Wow.
I know. She's a rock star.
You're a rock star.
Right?
You are a rock star and you are 10 under 10, right? You are really a rock star.
Yeah, I did receive. I'm honored to participate in the ADA 10 under 10 this year. I'm super excited about SmileCon. I hope all the listeners are going. It's going to be great. New Orleans is one of my favorite cities. So I am, I'm honored to be able to share some of the work that I'm doing with the nonprofit that I work with on this platform, because we know the ADA has the largest platform in organized dentistry. So I'm very excited and humbled to be a part of this group.
Ooh.
Yeah, this is great. This is a great achievement, and I'm so proud of you that you have been selected. It's a huge population to be selected from, right? So that's big.
Big thing.
Thank you.
We will be right back.
Laurel Road is committed to serving the financial needs of dentists, which includes helping you find the best path forward for your student loans. Laurel Road now offers free 30-minute consultations with one of their GradFin student loan specialists. Get the facts and develop a personalized plan by scheduling your consultation today at laurelroad.com/ADA. Laurel Road and GradFin are brands of KeyBank National Association. Need a snack to pair with your podcast? Grab something from your new fridge. ADA members get member-only savings on select GE appliances, including Profile, Cafe, GE Monogram Hire, and Hotpoint appliances. Visit ada.org/GE to get the special authorization code to access your savings.
Welcome back to Dental Soundbites. We're talking about sticky situations and fostering respect in the workplace with Dr. Zerita Buchanan.
You go and share, girl.
Okay, I guess it's my turn now, right? to share a story. So I'm interested to see y'all's reactions. All right. So mine is actually not with patients. And to my surprise, Effie, I'm so surprised you haven't had any like strange reactions, with patients or whatever. But the sticky situation that I was going to share was from a leadership perspective in the dental office, like with the dental team when I first started practicing. So it's a very short story. I was just trying to give some instructions to my team because you guys know, like for the most part, I'm like Miss Leadership as it relates to the dental office. I really believe that the dentist should lead and marshal things going on in the practice. Of course, being collaborative with, auxiliary staff, lab, DAs, yada yada. But there was this one time in my, I think, second or third year, I got a new manager, and it was another female, and we were both, fairly young. And so I was giving some explanations. I was like, hey, I actually would like it if you did X, Y, and Z this way. And in front of the staff, it was like a morning huddle, and the manager was like, I'm not doing this with you. Like, nope. I'm like shut me down in front of the staff. Like, nope, we are not doing this. Like, almost kind of like it's their show as opposed to, and I don't feel like it's a my show versus your show actually, but in that moment I was just like, oh, I was not prepared and I wasn't ready. And so I did keep composed. I kind of had to take a breather. And then later on we talked about it, and it was just like, all right, we're new to each other. We don't even know each other. We're just kind of going down this road together. I'm a new dentist. I'm like, I'm just trying to get quick on my procedures, trying to be accurate, but I also have a way in which things should be done. And, the manager was like, nope, nope, nope. And so anyway, we ended up kind of like working it out, and it's fine. We chat even now. We kind of laugh about it now, years later. But that was one of the sticky situations as it relates to staff, because I'm one of those leaders, and I'll be quick about it. I'm one of those leaders where I ask a lot of questions because I want to be clear on my expectations. I'm very communicative with my staff, and sometimes in dentistry, we're not like that. And so when you find a doctor that is very like involved and hands-on, it can be like, whoa, this is too much. You know what I'm saying? And so I'm interested to hear what you all's thoughts are about that.
Dr. Effie, I'll let you go first.
No, you go.
I would be shocked and appalled if someone said that to me in front of my staff.
I had no idea what to do. I just had to keep it together in that moment because I was like, oh, the staff is watching. This could go down and be bad.
Yeah, you do have to, keep your composure. But I'm glad you stood up for yourself, because that was inappropriate for her to say in that manner. When it comes to leadership at my office, I've always had the understanding that if you tell someone to do it, they need to be able to see you do it as well.
Oh, I love that.
So I never have a problem really, reminding my staff, hey, we need to take out the trash today. Or, hey, can someone go and Windex the mirrors in the bathroom? Because I would do it myself, and they've seen me do it. So if someone has seen you do the work, they usually will feel more motivated to do the work behind you, because they know this isn't a hierarchy structure. Now, at the end of the day, it is a little bit of a hierarchy, because you are the dentist and they are the staff team member. But I feel like if people see your work ethic and they see how you lead, they'll be willing to follow. And so I'm sure your staff, when they saw that situation, they knew your character and knew that you weren't just saying something to be rude, but you were saying something because it was important to the betterment of the practice. And that, probably is a testament to your leadership skills. So I'm sorry that happened to you, but I'm sure you navigated it properly.
I feel good about it, because now it's like a thing that we were just like, oh, got off to a little bad start there. You know what I mean?
Yeah.
I really like what you just said about the dynamic in the practice and the relationships and the way that they should be built. And I also have a little bit of an allergic reaction to the word hierarchy. And I know that it implies, this differential that many times poisons relationships, right? But I think that the alternative view of this would be, we like it, we don't like it. You have a team in the practice, but some people report to some other people, right? So there is this kind of a reporting dynamic and a relationship that is built with respect, but yet, You're the boss.
Yeah.
How else can I say it, right?
Yeah.
So it's really important when these relationships are built with respect, because if you abuse this dynamic and this differential, then it becomes a problem, in my opinion. So I like the way that you describe it, and the work ethic that we all have to portray it as we keep these relationships. You shouldn't expect people that, the people that report to you should be doing things for you.
It's alongside.
Yeah, exactly.
Perfect. I was gonna say, I think it should be like alongside one another. I don't really like to show up as like, oh, like some people say, like, throw your weight around. Y'all have heard that, right? Like, I don't necessarily show up that way in practice. And so it was an interesting interaction, but I'm glad that, we're past that.
And because I'm a little bit older than you, and I never play this card of being the older, I still feel that we are all learning in every phase of our lives.
Yeah.
But I just want to say that my observation is that more frequently women are placed in this situation of wondering where am I? What's my position? How should I do this? How should I deal? I find that many times and I see now junior dentists that go into the room and they own the room.
Yeah.
They don't have to think about these things. How am I going to portray myself? What am I going to answer? What if they say that I wear gray versus I wear navy blue versus I wear pink? I mean, yeah, pink in this society may be criticized. But the European society, no. It will be very natural. Everybody wears color. But, we women, we kind of second guess ourselves. And we're like, should I walk in like this, like that? How am I going to get more respect?
Yeah.
So, tough life.
Hard. Okay. Next up, Dr. Sapna Lohiya shares her story with us. So we're interested to hear another sticky situation.
Hi, thank you so much for having me. My name is Dr. Sapna Lohiya, and I am an oral and maxillofacial surgeon practicing in West Los Angeles. As a young female clinician, I can speak to many sticky situations or instances when my credentials or abilities were called into question because of the way that I looked. For example, I have had patients tell me that I look as young as their daughter, and I come to find out later that their daughter is just about to graduate high school. I've had patients ask me if I was strong enough to take out their tooth and question the way that I looked to be able to do that. By peers, I have been told that women don't belong in surgical specialties and that having a desire to start a family could affect my job prospects. The way that I typically respond to these situations are, I find that there is a small majority of people who aren't going to respect or trust you as a provider because of their preconceived notions. And for those patients, I reiterate how important trust and respect is in a doctor-patient relationship. So sometimes I will offer them to see my partners or to seek care elsewhere if I don't think that I will be able to achieve that level of trust and respect that is so necessary for patient care. For the vast majority of patients or people who are just speaking from a place of nervousness or anxiety or from their previous experiences with what their doctors have looked like, I speak to them in a way that shows my competence and speaking confidently so that I can help change the narrative. For example, for patients who tell me that I look as young as their daughter, I receive that as a compliment and I tell them thank you. I have now changed that narrative from one of, questioning my training and the time that I have spent training into receiving it as a compliment. And now we can move forward to the issue at hand, which is treating that patient for the reason that they came into my office. For patients who have questioned my strength of doing a particular procedure, I tend to tell them that fortunately, dentistry and taking out teeth is not as much about sheer strength as it is about technique and skill. And I find that reassures patients and helps to regain that trust. So that is typically how I handle those sticky situations. Thank you.
I picked up a lot from there. One thing that I love and that I wrote down as I love how she reframed her new response or changed the narrative, as she said. What are y'all's thoughts?
That was a very interesting clip. She touched on a lot of points. What stood out to me was the advice that your potential jobs will be affected by if you decide to start a family. And, you know, when I went back to Harvard, I got my MPH, but it was specialized in health policy. And so one of the things that I really thought about, a lot of my female classmates who are, you know, physicians and dentists, we went straight through school. We put a lot of time into our career. And it's interesting to me that different institutions do not support family planning for residents and interns through insurance. For example, when you are in graduate school, if you want to freeze your eggs, per se, there's not financial support for that. And so that, you know, kind of stops a lot of women from starting a family later in life. It may eliminate the option for them. And I hate that that's even part of our discussion. Like, why do we even have to think about that? That is not something that our male colleagues have to think about. So when we think about policy initiatives, one of the things, if we're going to talk about, hey, we need more women in the workforce, we need more women in these fields, well, we need to support them when it comes to family planning. If they decide that they want to have children in residency, they should not feel like their job is in jeopardy. And if they decide they want to wait, they should have the financial support of the institution to go through any type of procedure that will allow them to have children at a later date. So I sympathize with our colleague who made that clip, because I know what it feels like for someone to say, hey, think about that, how it's going to impact your career before you make that decision.
Yeah.
Both of our colleagues brought this up as several issues related to this inequity. And I'm glad that you had this exposure at Harvard and you looked at policy. And I mean, this is really very useful. The comments were right on point.
So I feel like we've covered a lot of scenarios in our episode today. We've covered everything from office staff, respect with patients, peers. This is a good time for us to do some big takeaways from today's episode. So Dr. Buchanan, you can start by sharing 3 takeaways maybe that we can do to foster a more respectful workplace from your perspective.
So the number one thing I think is show up authentically. When you are happy with yourself, you interact with people differently. So you'll interact with your patients and your team members in a positive manner when you take care of yourself and you're happy to walk in the door every day and practice dentistry. The second takeaway, I think, for new dentists who are listening, a lot of the things we touched on today will come with time. Don't beat yourself up if you are, you know, in year 1 to 5 and you feel very uncomfortable talking about money with your patients. Keep going, keep trying. It will get easier. And I think the last thing to think about is for, you know, our male colleagues who may be listening, speaking up when you hear something is so important. If you hear your colleague being disrespected, your female colleague being disrespected, please do not feel afraid to speak up in the moment, because allyship is so important. As we, you know, progress in our careers, there is going to be a time where we all need each other, especially if you're in group practice. So if you hear, you know, a patient or a team member is treating you differently than they're treating a female dentist, take a moment to say something. We all need support in different arenas. And I think that is, you know, something that would really be appreciated by your team member.
That was phenomenal.
That's really important. And it's really true that we need to count on allies. Mm-hmm. It's really important. Mm-hmm. Like, silence will not protect you, as I say.
That is the realest quote I've ever heard. Silence will not protect you.
Right?
On the next Dental Soundbites.
We're talking about cultivating a leadership mindset to create change at work, at home, and in your community.
This was such a great conversation. I love it.
Thank you.
Thank you so much for joining us. Thank you so much for sharing your wisdom. I'm impressed, and I have hope for the profession, because when I met Arnel, that was like, I love this. I love this girl. This is our future. And now when I see people like you, Zerita, in our profession, and you guys have such wisdom developed in such a young age, I'm like, I salute. Respect, for sure, respect. Respect. Mic drop.
Yeah.
Thank you.
Well, before we go, we really want to say thank you again so much for being on the show with us, Dr. Buchanan. Can you tell our listeners how they can find out more about you and where to follow you online?
Yeah, you can follow me on Instagram. My Instagram is just my first name, Zerita, Zerita, and the initial B, so Zerita B on Instagram. I am also going to do just a little shameless plug.
No, it's not shameless. No.
To learn more about some of the work that I'm doing. When I was asked to be a part of the ADA 10 Under 10, they highlighted some of the mentorship work that I'm doing to diversify the dental workforce. And the nonprofit I work with is called I Did Pipeline, Increasing Diversity in Dentistry Pipeline Program. We're a 501c3, and our mission is to eliminate the racial disparity in the dental workforce. So if you go to ididpipeline.org, you can learn more about our 501c3, and you can help to support students who are interested in entering the field.
Oh, that's so great. And we need this.
Yeah. We are so glad for the work that you're doing.
We definitely need this.
Thank you. Thank you all for, allowing me to share on this platform. I appreciate the work that you all are doing.
Thank you. And if you guys like this episode, share it with your friends. Then be sure to subscribe to this podcast wherever you're listening so you can get the latest episodes, people.
Yep. You can also rate it, you can write a review, and follow us on social media.
And don't forget, the conversation continues on the ADA member app. Catch all the bonus content, and we have a lot of this. Everything you did not hear on the episode.
Thank you for joining us. Dental Soundbites is an American Dental Association podcast. You can also find this show, resources, and more on the ADA member app and online at ada.org/podcast.